that has proven true. On a day we surpassed 10 million in the nation of infections, identified infections, 240,000 of our neighbors dead. In Minnesota, we're at 190,000 confirmed cases, and 2,698 of our neighbors have lost their lives during COVID. In the beginning, we pledged to you that the responsibility that was rested in me by the people of Minnesota was to make sure that the health, safety, and well-being of Minnesotans was protected, and that we would make decisions in collaboration with healthcare professionals. We would use data, and we would include the community in how we moved to preserve life, preserve health, and to build up the capacity necessary that every Minnesotan would have access to healthcare should they need it by infection. We've worked hard to control the rate of that infection. We've worked hard to make sure that the personal protective equipment was there, and that we protected those frontline workers, the nurses, the physicians, the child care workers, the teachers, the grocery clerk, the police and firefighters. But I have to, just as I said in those early days, be absolutely candid in Minnesota that we are in the midst of a significant surge in coronavirus cases. I wish I could tell you that this was unexpected, but it was not. We've been talking about over the last 8 months how much we've learned about COVID-19, and how much we've learned about our behaviors and how we impact that spread will have that impact. This quote is from the White House Coronavirus Task Force. There's an unrelenting broad community spread. It's going to require aggressive mitigation to avoid additional increases in cases, hospitalizations, and deaths. That, once again, is an absolutely predictable, unfortunate, but absolutely predictable outcome if the spread of COVID is not contained. If unmitigated community spread, if we are not testing and contact tracing and isolating folks with cases, we are going to get this. And so over the last about 10 days, we have seen that exponential growth in Minnesota. We've seen it hit record cases of identifying, and that's not just because we're testing more. We kept and did, because of the sacrifices of each and every one of you, because Minnesotans have looked out for their neighbors, we were able to keep our infection rates at a much lower rate than a large portion of the country. And if you look at this slide, we saw our peak in May, and we were learning at that time. We did not know a lot about this. We had asked Minnesotans to do a 51-day basically stay-at-home order, and you did that. Our hospitals built capacity. We sourced PPE. We learned how to live with, to a certain degree, what was happening with COVID and adjust our behaviors. And over the subsequent months of June, July, and August, while we saw spikes in the rest of the country, Minnesota remained at about a 5% positivity rate. Well, unfortunately, as you look at this chart, that has changed dramatically. And as we've talked about from the beginning of this, the fear is once you lose control, once you go above 5% positivity rate and you start getting into the neighborhood we're at today of 14.4 or so for today's numbers, you start to see that line go absolutely vertical. If you're looking at this chart at home, this is a 1 week lag. When we add what's happened this week to that, this line would go off the top of the television screen here because we are at 6,000 cases, nearly doubled. And again, that type of spread and that type of spike will continue unless we make mitigation efforts, unless we choose to adjust behaviors that we know the data supports will start to bend that, and will also make sure that, that our hospitalizations and our capacity remain the same. When this originally started, just like anything that is close human contact, we saw the spread was much higher in urban areas, not surprising. In the upper Midwest, outside of Illinois and Chicago area, Minneapolis is the largest urban area, bigger than about 2 times bigger than Milwaukee. And if you look at surrounding states like Iowa or Nebraska or South Dakota or North Dakota, much more rural. So in the beginning of this pandemic, you started to see numbers much lower. I would make the case that that lulled people into a false sense of security. Not the team at MDH, not the team at our healthcare partners, not the team at the White House Coronavirus Task Force led by Dr. Birx. We understood early on it would just be a matter of time. And if you're looking at this chart, every corner of our state is being impacted by this, some much more dramatically than others. And the thing that I think most of you out there understand is why we're collaborating together and we have our capacity for hospital space, bed space, and I'll talk a little bit more about the real critical piece of this, those professionals and the staff that are there, they are not equally dispersed across the state. So in some areas, a spike of 100 or 200 cases requiring hospitalizations reaches us to that critical stage where we need to move into surge capacity. And I'd just like to reiterate to Minnesotans, the hard work that you did to buy that capacity is paying off, and it will continue to pay off in the future. You've seen it in states surrounding us where they started to move into their surge capacity. State of Wisconsin set up a hospital at their state fairgrounds. We have that capacity. The professionals you'll hear speak after I'm done here will talk to what that is. So this is not a situation where we're panicked. It is not a situation where people are not going to get care, but it is a situation that it will change dramatically. And our ability to be able to deal with this will change very, very quickly. A couple months ago, I mentioned the surge in Arizona, where Arizona went from 5% positivity rate to 20% positivity rate in about a matter of 2 weeks. And I said that will happen here if we don't make some of the right decisions around this. And I didn't say that because I'm looking to the future or guessing or hoping it would not happen. It's because it is the absolute path of the virus. And so what you're seeing now is where Arizona was around the 4th of July is what appears to look like where Minnesota's at. Just 10 days ago, Minnesota was 21st in infection rates, about in the middle of the country. North Dakota was 1, South Dakota was 2, Wisconsin was 3, Iowa was 4, Nebraska was 5. We will quickly join that group if we don't make the decisions that can mitigate that and start to bring that down. So, excuse me. Talking about the healthcare capacity and this our surge capacity, you're going to hear from Dr. Morris and Dr. Gorelick in just a little bit to talk about what this is. Just to be clear, we don't build out massive amounts of empty hospital space. It doesn't make sense economically. It doesn't make sense space-wise. So our hospital capacity, what we've learned is whether people have the flu, they're in to give birth, they're having appendicitis, or God forbid we have an auto accident, we're able to handle that. And there's enough built into it if certain things happen. But this is not a certain thing. For those who are wondering right now, the first weeks of December tend to be the peak hospitalization periods for flu, and we're starting into that season. As we speak, there are 4 people statewide hospitalized for flu, unlike the 1,200 plus for COVID, and that will certainly go up. What you're looking at is beds in use, capacity in parts of the state, and then beds available. That beds available, I hope everyone's able to see how very, very quickly with an exponential spread. We've been looking at cases 4 and 5, 6,000, positivity rates now average over 10%, and deaths and ICU capacities going up. It is absolutely heartbreaking, but we can project with some certainty where we're going to be in 10 days and where we would be in 20 days. What we have the capacity to do is start to change that by our behaviors. But you will open your paper and it will not be unusual for you to see 50 or 60 potential deaths based sheerly on the numbers of where we're going. So that's why it is so critical that at this point in time, we take a look at this. And here's what's happened. As it's spread more, obviously more people are going to need hospitalized. We said early on about 15% of people, and this is when we were first learning about COVID, about 15% of people would need hospitalizations and about 5% of them would need ICU capacity. I think that number, and the doctors can probably talk to a little more detail, I think it's probably closer to 10 or 12% need hospitalized and about 2 to 3% need ICU. That's a great testament to the therapeutics that we've come up with, new ways of approaching this, and just sheer will of of the healthcare providers to figure out better ways to care. But if the volume increases so dramatically, even that 10 to 12% that need hospitalization or that 2 to 3 that need an ICU will overwhelm us. And the real problem we have is this. While we built up and we have surge capacity, we have N95 masks, we have the proper protective equipment, we're simply running out, and this is what's happened around the country, of personnel, because they're also getting COVID. They're also getting hit by this, and what ends up happening is that our staffing shrinks to the point where it becomes impossible to even fill the rooms if we have them to provide the care necessary. And again, Minnesota, and it's a testament to folks like Dr. Morrison Gorlick, who will be up here in a minute, Minnesota had a better handle on this with a better view of how many beds we had, and we're able to cross-level people to other facilities to be able to get a handle on that. But this is not just isolated to certain areas. It is statewide and nationwide shortage of healthcare providers because of this surge that's happening, especially in the upper Midwest. Well, now this one is, how do we respond? And from the beginning, my pledge to you was to follow the science, to follow the data, to understand the social implications of the decisions we made and what that impact would be, and try and provide a balanced approach. This Venn diagram shows the Stay Safe Minnesota, the well-being, the economy, and controlling the spread, and trying to strike that balance. I told you one of the first times I spoke with you during the stay-at-home order is that could not go on indefinitely. The economic, the social, the health, the mental health aspects of a prolonged stay-at-home order would be too detrimental. We had to find a way that allowed us to find some way of sustainability. Now, for a lot of months, Minnesota was able to do that. But I think the White House Coronavirus Task Force was also deeply worried about us in June and July because they saw us staying flat and not going down. And it felt like something was going to have to break at one point or another. And unfortunately, once it came to the upper Midwest, and I think that there's a lot of data starting to be gathered about this, more than likely the thing that many of you know is as we started to move back inside, we started to see the spread happen more. And as Chris Erzman, our infectious disease director, reminds me often, there's ways that we can reduce the risk, but not eliminate it. And just because reduced risk does not mean no risk. And I think for some of us, all of us, and I include myself in this, that belief that if we just gathered with family in our backyards or just in our dining room, and these are people that we know, that would be okay. What you're going to see is that is not okay. And that's where a lot of this spread is starting to come from. And so in this, that middle piece of this, each of us has a role. This is where, and I continue to say this, if we want to slow the spread of this, if we want to do the things we know that we love to do and have our kids in school, we're going to have to take the ownership of this and bend this curve through proven practices that make a difference. Again, I want to highlight some of you, if you go Google it, I think it's our students in Martin County, a group of students put together a very factual, data-based, scientific approach of what it takes, wearing masks, social distancing, get a test if you need one, isolate, and help communicate with contact tracers to get a handle on this. They were doing that because they said, we want to be in sports this fall. We want to be in school. We want to learn. We want to think about our futures. And they made a video asking their community to help them with this, help by doing some of these things. So I want to just be very clear. Wherever it got that there was a false choice that do you want to play football or go to school or have businesses open, or do you want to fight COVID? That was an incredibly poor way of folks to think about this, because the only way we're going to be able to do those things is by containing this virus and defeating it. And we do know that there's some positive light at the end of the tunnel, certainly therapeutics, but potentially the vaccine that are out there. But until that time, it's within our control, and that's what these students were saying. If we want to get back to the things we love, take some control over this and start to do the things that mitigate the spread. So here's what we're seeing. We're seeing spread in every part of daily life in all settings. This diagram just shows, much like that, you may think it's isolated to you, but as I said, with family gatherings, you may be with a brother and sister-in-law, and they may bring one of their children who's been very, very careful, but just happened to have contact with somebody else who they thought they were being very, very careful. And pretty soon you have a network of people where this thing spreads. And we know how it's spreading, and we know where it's at. It's not being caused by one or two major events. But I want to be clear, whether you're celebrating an election victory in a large crowd or you're storming a football field after a game, those things are incredibly risky. They are things we can't do at this time. And just to be clear, all of it needs to be avoided. But the data seems to show us the who, what, and where that spreading this is much more. We can be much more granular with that now. We can be much more detailed about how we approach it. And here's where it's coming from. And this is just, and I would let the health experts have spent a lot of time with me. This is a very unique, novel coronavirus for a reason. One of the things is the asymptomatic spread is the most pernicious part of this. This is dangerous because we can't see it. We don't know it. And there's a whole lot of folks, especially young people, doing a lot of things right. My goodness, we're asking them not to do the very fun things that make life so enjoyable, and they're doing it for the most part. But it's also lulled us into a sense of, a false sense of safety. You don't see it on them. They are not sick. They are legitimately asymptomatic, and they believe, and in many cases they're doing almost everything right, but they're infected, and they are contagious. And that 18 to 35s, as you see on this chart, this is just 1 week in our lag period, a week and a half ago. The bulk of those are under age 35. And while most of them will not up into the hospital, some will, and while a small percentage of them don't get real sick, some do and some die. But what's happening is they are spreading it into the older, the more vulnerable populations, and that is where the uncontrolled spread happens. So we know that's where it's coming from. Now I want to be clear. This is not pointing fingers. This is not blaming. This is young people have been incredibly, as I said with the group in Fairmont, incredibly proactive on trying to help this. But the way this thing is spreading, I think Dr. Birx gave us the number that she felt at some of our universities, the asymptomatic cases may be upwards of 70%. And I think many of us almost fell out of our chair when we heard this, that was several weeks ago, and she felt that was the case. So, the social settings, where 18 to 35-year-olds go. What we're seeing is the spread in private social gatherings, weddings, funerals, private parties, and other small things, backyard barbecues, those types of things, and then late night outing to bars and restaurants. And I'd like to make note of that we're getting the data so much better at the data on this that we actually know statistically after 9 o'clock when we contact trace that we're seeing a doubling, at least a doubling of infections that are happening after 9 o'clock as opposed to earlier in the evening. And this is where human nature, I let some of you decide on that, how that works is people just get a little more socially lax as the night goes on, and especially in settings where alcohol is served. And again, I am not passing a moral judgment. I'm just simply stating scientifically where the facts are. And if we're going to get a handle on this, we have to know who is spreading it, where they're spreading it, and then, of course, when they're spreading it. So these are the outbreaks that we've seen from June through November. 71% of our spreading cases are happening in private social gatherings, weddings, funerals, restaurants, and bars. And about 29% in other settings, workplace settings and other controlled settings. We've said from the beginning when people ask, well, why are you keeping these things open and these things not? There was a rhyme and reason to it, and what we know is that if people were able to social distance, if they were able to social distance outside, certainly, but if their contact was very predictable about where they went, what they did, kept the mask on, we knew that there would be a reduction in those types of activities. For example, retail. We're not seeing a lot of spread in retail of people going in and buying a candle, going in and buying groceries. That's not happening. So, what makes it so risky? I just think, and for some of you, and I say this, I'm in the same boat as all of you, you think seeing a brother-in-law and sister-in-law at an outdoor patio setting, socially distanced, that poses very little risk. Now, again, as Director Ersman would say is, it poses less risk, but it doesn't pose no risk. And I think what's happened is you become a little more complacent. You're comfortable around these. These are family. If you're in a setting where you're eating or drinking, obviously you have to have your mask off to do that. And the longer you have that mask off, the greater chance you have infected. The more people you add into that mix, the greater chance you have infected. And loud settings, the louder you speak, if you're singing, if you're playing darts, standing next to someone in a crowded bar and you're yelling back and forth, it seems like these things shouldn't be as risky or elevated. What we've seen is that they do that. And then, of course, alcohol lowers inhibitions, social distancing, night wears on. I want to be clear. It's certainly not our intention to demonize any industry or any activity. It's simply important for us to understand what we know 8 months into this, what spreads this thing, who gets it and is more likely to spread it, what's happening with asymptomatic spread, and what is our most targeted approach, our most surgical way of looking at reducing these things, all again to make sure we don't overwhelm the hospital system, we don't overwhelm the staffing that's at those, and we buy ourselves that time towards we get to a vaccine. So here's what we're going to do today. We came to you early on and pledged to put out the data. We have probably one of the most transparent dashboards in the nation around where information is. We've turned our dials. We're going to have to turn them back a little bit today, and that's what we're going to do. By being able to use that more targeted approach, it lets us keep those activities open, both from an economic standpoint, a well-being standpoint, the things we like to do standpoint, but targets very specifically ways that we think we can slow this spread. I would also note that one of the things that will coupled with this is, again, if we want to know who has this, we need to be able to provide testing on a wide scale. And yesterday's announcement was one more addition to that with all of our partners. Minnesota's depth and breadth of testing probably puts us amongst the top states in the country, and we built in the capacity that we controlled our testing by having the labs here. So we're going to have the ability to do this. And I would ask, and we saw this yesterday with our new lab at the Civic Center in Minneapolis, we'll have 11 opening up at armories across the state. We're trying to eventually get it where you can take the kit home, send it back, and have an answer in 24 to 48 hours. If you're 18 to 35, you're feeling healthy, you've done a lot of things right, but you just want to know because you want to protect your family, you want to protect your neighbors. Almost all Minnesotans are now within 30 minutes of 2 options to test. And again, this is barrier-free, pain-free, cost-free. Go in there, get it done, get a result, then let's start moving. So what we're going to do is limit of 10 person for indoor gatherings and outdoor gatherings. That just allows the two together to align. 3 households or less, including the host. You mix more households, obviously it just adds a whole nother dimension, meaning you've got 2 brother-in-laws and the 2 sisters-in-laws and yourself. You can bring them in, but I think, again, I keep coming back to this, you have to social distance, you have to wear a mask, and you have to recognize just because they're family and just because you know them, you've not eliminated the risk. And then this will go into effect at 10 p.m. on this Friday. We need to move now. This has happened incredibly quickly. You saw the stories of hospital systems around us that are already overwhelmed. We are still in a position to be able to handle this. There is going to be a lag time. This is the wave already breaking on the shore. What we're able to do is to shore up a little bit to push back after this one breaks for the next one that will come. Receptions and similar events. We're going to do a phased-in approach. Again, just to be clear, weddings and funerals, these are hugely important human activities, and it is incredibly painful not to do them. But what we're seeing is not the actual ceremonies involved in this, but the social gatherings afterwards. And this is a phased approach because, just to be candid with you, some of you have planned your wedding for 6 months or longer. You've planned it since we made some of those changes. Our intention is not to make that difficult for you. It's to make that day special without having it marked by an outbreak of COVID or the problems that come with it. So we'll go to a 50-person limit on the 27th, 25-person limit. And then these events will not happen from 10 p.m. to 4 a.m. And there's no change in actual weddings, funerals, other similar ceremonies. Only those things connected with that reception or the celebration piece where food and beverage and those types of things are served. And again, we're not just randomly targeting these things. The data shows that a bunch of our outbreaks are coming from these types of activities. Again, no ill intent by the people involved, but this is how COVID-19 works. Bars and restaurants, indoor and outdoor capacity of 50%, no more than 150 people. Counters are closed for seating and service unless counter service only. Patrons need to be seated at tables. No bar games that require standing is permitted. And again, I just like to say, I've got a 19-year-old who went back and watches kind of an old movie classic, and I feel like the guy in Footloose, no dancing, no fun, no whatever. That is not my intention. My intention is to keep you safe so that you can all dance a lot longer and that our neighbors don't put them at risk. But I recognize this is painful. It's no fun. I'm as frustrated as you are. We should have broke the back of this thing months ago in this country. We have not. But now is the time for us to do it. No dine-in service 10 to 4, but open for delivery and takeout. And I'm just going to say, our hospitality industry has done more than anybody should have ever asked of them. And they have done it so right, and they have gone to great pains, whether it be filtration, whether it be plexiglass, whether it be masking. And this is happening not because they're being lax, but because it's the setting that the virus is most effective at spreading in. And that is incredibly painful. I would encourage all of you, spend money at these businesses. My wife today ordered Thanksgiving dinner for our family from Colossal Cafe, and they're going to provide it, and we'll go pay them and be grateful for what they did. We can all do some of that to keep these folks going, but I think it's really important to recognize they have made every effort possible, and this is going to be painful. This is going to be painful for them, and we can help a little bit. This goes into effect this Friday night at 10 p.m. Here's what we're going to do today, coupled with it, especially targeted for those restaurants and those small businesses being impacted. We have $10 million that's in the Small Business Relief Grant Program. This is money that can move immediately to them as grantees. We know that this does not make them whole. We know the federal government's PPP program helps some of them, but not all. But our hope is to buy a bit of time here. And I'm telling you folks, if we can break the back on this thing, we can get through this over the next 4 to 6 weeks. We see some of the promise with the Pfizer announcements and some of that. We can get to the other side of this without putting more people at risk. So this $10 million additional funding, businesses have already applied for relief, help about 1,000 more businesses pay for their bills, pay their workers if they need to. So we have to take the strong steps. I recognize the regulation alone is not going to do it. I'm making the plea to you once again. You've done an incredible job with it, but we can't let down. Whether it's COVID fatigue, whatever it might be, the data supports, and it's there, masks work, social distancing work, keeping indoor gatherings to a smaller number, making some of these smart choices will make a difference. It will save people's lives, it will keep people out of the hospital, and it will allow us to go back to school, keep our businesses open, and get back to normal faster. So I'm asking you, keep those things in mind, get tested if you think you need it, and let's beat this thing. So I'm going to bring up Dr. Morris in just a moment. You're going to hear from him, Dr. Gorlick, and then Commissioner Grove. But Minnesotans, you deserve to hear where things are at. This is a day we hoped would not come, but hope was not a plan. The state of Minnesota planned for this day. We knew it was there, and here we are. So just like I've said before, we are a resilient people. We're pretty gritty. We're pretty tough. We're going to need it now. This is the worst part of the pandemic. The darkest days are going to still be ahead of us here. But what we've learned in the last 8 months and the work that we've done is we can make it much better than it would be if we didn't do that, and we can get to the other side. This is a bridge to potentially the end of this thing. So with that, Dr. George Morris is the Medical Incident Commander at CentraCare, focusing on COVID-19 response.
Thank you, Governor, and thank you, everybody, for your time. I'm Dr. George Morris. I'm the Physician Incident Commander for CentraCare. CentraCare is a large, complete, full-service healthcare organization in central, western, and southwestern Minnesota. We serve over 800,000 people throughout 8 facilities, including many additional long-term care, senior housing, and clinics throughout the area. We're getting hit hard right now. This is a time, as the governor kind of showed with the data, where we're seeing the numbers go up and we're seeing the surges happen, and we're seeing it hit us, and we're seeing those patients in our facilities. Currently at St. Cloud Hospital, which is our largest facility, we're seeing about 1/3 of all of our inpatients are COVID or related to COVID illnesses. This is an astronomical number. And we know that that number continues to grow as we see the virus spread through our communities. We're also seeing of those inpatients, about 1/3 of them are requiring critical care, that ICU level. Those beds that are very key, along with the staff that are needed and the expertise to provide that high level care. While we know that those are our critically ill, the highest risk, the most severely affected, we are also seeing more and more cases happening in the younger patients. We have patients in our hospital in their 20s, 30s, 40s, and we're seeing them suffer severe illness due to COVID. What we're also seeing is how, as the virus spreads rapidly through our communities, the key aspects of testing, tracing, answering the phone call, and being aware of your surroundings are what will help us kind of mitigate the risks and decrease the spread of this virus in our areas. These are going to be the key factors as we try to balance our COVID response. In essence, we are still providing high-level care for the routine medical needs, accidents, heart attacks, strokes, medical care that we've been providing in our communities for years. This is our purpose. This is what we do. This is our goal. While we're now adding all of the COVID-related illnesses, and we're seeing its effects on our staff. We do see concerns with fatigue. This has been a long road. We think about it as a series of marathons that we've been struggling with throughout this crisis since back in March and even before that, such as January when we first started to put our plans in place. We're seeing our staff struggle with their own illnesses or their quarantine from families or their contacts and concerns about their own safety. We have them available now, and we want to continue to keep them available because we haven't even hit the peak yet. So as we see this and as we prepare for those responses, that's really where we're looking for each of us to understand our role. And our role includes the basic things that we know are effective. Wear your mask, wear it properly. Do social distancing, both indoors and outdoors. Maintain the emotional connection. While we understand we have to be apart, we really want to encourage people to be aware of your own behavioral health needs and those of everybody around you. So be sure to connect with each other. Wash your hands. Minimize those social gatherings. Stay home if you're ill, and let people know how you're feeling. Governor, thank you very much for your time, and appreciate it. And this is our time as a whole state to kind of come together and really tackle this virus. Thank you.
Dr. Morse, thank you. We'll now be joined by Dr. Mark Gorelick, President and Chief Executive Officer of Children's Minnesota.
Thank you, Governor. Thank you, Commissioner Malcolm. Thanks for your leadership, and thank you for inviting me to be here and to share a little bit of the healthcare provider system perspective on all of this. My name is Dr. Mark Gorelick. I'm the President and CEO at Children's Minnesota. Children's Minnesota is one of only about 32 independent freestanding pediatric health systems in the country, and we are based here. Our 2 hospitals are in the Twin Cities metro, but we see patients from every county in the state of Minnesota and from the surrounding states as well. As you've heard, we are facing a dramatic increase in the number of cases of COVID-19, including in hospitalized patients. Today, we set a record at Children's Minnesota. We have 13 kids in the hospital, including 5 children in intensive care. That's the most we've had since the pandemic has started. Now, throughout this pandemic, I think we as health systems have prioritized first protecting the safety of our patients and our staff, and second, preserving our capacity to care for all of the patients who require our services for COVID-19 or for non-COVID related reasons. Early on, our challenge was primarily around supply shortages, but now our primary limitation is around staffing. And that's because while we have extensive measures in place to prevent exposure to COVID-19 for our staff within our walls, they are part of our community, and they are therefore at risk from community spread just like all the rest of us. And again, at Children's Minnesota, we are setting records. Today we have over 200 of our staff who are out, the vast majority because of a COVID exposure in the community. Now, this is not the first time the healthcare system as a whole has faced capacity constraints. Governor showed some data. It's not like we sit around with lots of empty beds. That would be very inefficient. And so we have mechanisms, we have systems in place, both individually and collectively, to manage that capacity. All of our systems daily, multiple times a day, we look at all of our scheduled care, we match it up with the resources we have available, and we make adjustments as necessary. We are seeing some systems now in our state that are starting to have to defer again necessary but not time-sensitive care. We also share data across our systems. We have something called the C4, the Critical Care Coordinating Center. All of the large health systems share information on staffed beds, and it allows us to balance the load between our hospital systems so we can find capacity for patients potentially from one hospital to another. By and large, this system has been working well for us, but we're at the point now where we actually need to take steps to increase that capacity and not just management. And first and foremost, we need to do that by using evidence-based public health measures to limit community spread of coronavirus. It will decrease the number of COVID-19 patients who need our services and decrease the number of our staff who need to be out. That means wear a mask, wash your hands, watch your distance, and limit opportunities for exposure in group settings, social settings, both especially indoors. We have to also take steps to enforce that. You know, one of the most insidious things about this disease, as the governor mentioned, is this asymptomatic spread, especially from young people, young adults, whose own vulnerability might be quite low, but they have the capacity to spread this to those who are more vulnerable. And that just re-emphasizes the need to be very vigilant about these protective measures that we need to take and not let our guard up. I would also put in a plug for flu vaccine. It's one of the best ways to keep people out of the hospital and to keep our staff safe. So if you haven't gotten a flu shot, get your flu shot. On a staffing side, we also need to follow evidence-based guidelines that allow healthcare workers who have certain exposures, who themselves are testing negative and are not symptomatic, to work safely despite that exposure. You know, today I was on my way over here. I passed by, as I do every morning, the sign outside our hospital. It's the SEIU put up a sign celebrating our healthcare heroes. And we have many healthcare heroes: our nurses, our respiratory therapists, our doctors, our environmental services team, social work, interpreters, so many others. They come in day after day, giving their all for those patients with COVID, but also kids with everything from prematurity to leukemia to congenital heart disease to appendicitis. They need those staff there for them. We are doing everything we can to keep those staff healthy and safe within our walls. If you support those healthcare heroes and you want to show it, do everything you can to keep them healthy and safe out in the community. Wear your mask, wash your hands, watch your distance, and follow the rules. Thank you, Governor.
Thanks, Dr. Gorelick. That last message is one that I would just echo, and thank you for that. And I would note that I, as governor, obviously been able to understand and see this a little deeper, but I hope all of us know how lucky we are to the coordination and the quality of health care that Minnesota has. This idea of the C4 and that communication happening together, that's a rarity amongst states. Many did not have that capacity. Some are just trying to build it. These folks and our systems had that in ahead of time. And with that being said, I'm going to turn it over here to Commissioner Steve Grove, and I'd like to note someone who spent their entire life building jobs, creating innovation, understanding that our free market economy and the work that's done out there provides us a quality of life for so many of us, and that has been under threat that most of us, almost all of us, have never seen since the Great Depression. Only those that are of our seniors have seen anything close to this. And I'd have to note that Commissioner Grove is the one that's on the front line dealing with businesses who are in shock, who are in financial straits, who are angry, confused, all of those things. And he is the one that brings their voice, making sure that they're heard when we're making these decisions. With that, Steve Grove.
Well, thank you, Governor, and thank you, Dr. Morris and Dr. Gorelick. Good afternoon, everybody. Steve Grove, Commissioner of the Department of Employment and Economic Development. We, of course, wish we weren't here sharing these new guidelines today, and in large part because of the fact that the same social safety nets that we had 6 months ago when dialing back was necessary aren't there anymore, right? These extended unemployment benefits that came from the CARES Act, the PPP program, the federal stimulus, those things aren't here. So when the governor makes decisions about the need for further restrictions, the economy plays a critical role in all of those decisions that he makes because they have very real effects, as he said today. And this has never been about sort of public health versus the economy. Those things, as we've all seen, are so tied at the hip. We can't really begin economic recovery in a full sense until we get this pandemic under control. So, we really believe that by taking targeted action today, we have a shot at preventing long-term harm in the economy and trying to turn this thing around together with business and government partnering together. The devastation this virus has wreaked on our economy is significant. We've lost over 380,000 jobs since this pandemic began. That's a stunning number. We have paid out over $8.5 billion in unemployment insurance payments since this pandemic began. That's more than 10 times we've ever paid out in a single year in unemployment benefits. That even includes the Great Recession. But in recent months, things have turned around. We've gained about half of those jobs back. Job growth is on the rise. It's not as fast as we would like, but it is positive. And we're down to about 260,000 Minnesotans who every week claim unemployment insurance benefits. So the trend lines have been positive. We come today with a sense of urgency to continue to keep those trend lines positive, to continue to see that job growth, to see it pick up by a lot more, to continue to see more people get off of unemployment insurance benefits rather than on. But without these targeted efforts, we don't think that's possible. So there's really an economic message here, I think, today, in addition to the public health one. We talk, as the governor mentioned, across the entirety of state government with hundreds and thousands of businesses every week. We hold roundtables with hospitality industry, with chambers of commerce. Those consultations have been critical for us to figure out what kinds of targeted steps we can make, what will work and what won't. And by looking at that data, by consulting with industry, we're trying to be as thoughtful and careful as we can to minimize economic harm while maximizing public health gain. And so really this is about working together to keep that economy moving and thriving. As the governor said, we really encourage people, especially here at the end of the year, so many businesses, the fourth quarter of the year, the holiday season, that's the time. That's the time when they make up so much of their revenue, whether it's through the hospitality industry, through retail. At a time when online shopping habits might be encouraging you to look to national chains to buy things, look local this year. Look to your main streets. Get out there and find a way to support those businesses at a time that's really critical. Get takeout like the governor and the First Lady have done with Thanksgiving. My wife Mary and I are doing that at least once or twice a week too when we can, and it's so important because it's needed more now than ever before. As the governor said, we are increasing the size of our small business relief grant to an additional $10 million. The way that works is that additional $10 million will go to businesses who've already applied and who were selected on the wait list for the lottery for that program. So more information on that coming soon as we work through the process with legislative leaders in the LCRC later this week. But make no mistake, that's not going to solve the problem for the challenges our businesses face. What will is if we all start to really buckle down, follow these guidelines, wear our masks, wash our hands. Not only does your public health depend upon it, but your local economy does too. So that's really, I think, the important piece of this message just from an economic standpoint today. And with that, Governor, I'll turn it back over to you.
Thank you, Commissioner Grove. And for all of you, I know this is not pleasant, but you deserve the truth. The state of Minnesota has prepared and put ourselves in a better position than many places. And here's the bottom line. You have control over where this thing goes. You have the control over your wearing of a mask, the behavior, the social distancing. All of those things are the way that we can get a handle on this. This is not inevitable that we end up in a crisis situation, but if we don't do these things, we certainly will be there. And again, I want to thank you for the sacrifice you've made. We've got a little while longer. I don't know what inning we're in. I hear our friend Dr. Osterholm say that. He would have joined us today, but he is, of course, on the President-elect Biden's coronavirus task force, so the voice of Minnesota is being heard there. Wherever inning we're in, these are the things that we can do to end this thing. We can do it as fast as we want to, or this thing can drag on longer. None of us want to see that. So I want to thank you. We're going to leave here, go over and take some questions from the press and get this information out. So thank you, Minnesota.